from the top and go down. This is from an exam I gave years ago that I don't really use the questions anymore, so that's why. It has a lot of signs and symptoms, and so I thought maybe it would be a good review, so you would know some things that you need to review, because it has a lot of signs and symptoms. So let me make this a little bigger. And I know Amy and Jokey, you were here with me yesterday, weren't you?
Yes, but I missed the fast. I think I came in late, so this time I didn't. I missed like the first few.
Okay. Well, that's all right. I don't mind you being here twice.
Thank you.
Maybe I'll say something today that you will remember later on.
Yeah, you just did with the
Oh,
yeah.
Okay.
Yeah.
Okay. All right. So I'm going to do this like I did before. You guys are going to try to answer the questions, and I'm here to clarify anything. So I'll start with Sumi. You want to try number 1?
You want me to read the question or?
What, Sumi?
You want me to read the question?
If you want, or.
The nurse is reviewing the chart of a confused elderly patient whose urinalysis shows a bacterial count of 234,000 per milliliter. Incomplete blood count shows a white blood count of 14,800 with a shift to the left. What symptoms does the nurse anticipate the patient to complain about?
So what do you think is going on with this person?
Infection?
Yeah, some kind of infection, but what kind?
Sepsis?
No, not necessarily. I
UTI?
mean, they might be going into sepsis, but let's start easy.
Is it UTI?
Yeah, UTI. UTI.
Oh, I said UTI, but maybe the microphone didn't work.
Oh, did you? Okay. So what kind of symptoms would you expect the patient to complain about?
I would say A.
Yeah, dysuria and suprapubic pain. Yep. Would you have oliguria and what is oliguria and periorbital edema maybe point to?
Oliguria is not having, oh no.
Go ahead and tell me what it is.
Less having urine.
Yeah, so that's about less than 400 milliliters per day, right? That's the definition of oliguria. And then what's periorbital edema?
It's getting swollen around the eyes.
Yeah, and what does that point to? What could that point to? We just were talking about it.
Maybe that towards to sepsis?
No,
but
Dick was talking about urinary tract infections, but periorbital edema points toward glomerulonephritis.
Yeah.
Specifically nephrotic.
Yes.
Okay. And what does anuria mean?
No urine.
Right. And what does cocoa colored urine mean?
Hematuria?
Hematuria. Yeah, there's the other word for it. So in cocoa colored urine points to what?
Has blood.
Yeah, it has blood. But what kind of urinary renal problem would they have with cocoa colored urine?
Nephrotic.
Nephritic. It's nephritic. The one with the the antigen antibody complexes. And then headache and urinary frequency. Yeah, they could have urinary frequency if they have a UTI, but I just threw those in for jollies. Okay, number 2. Charmaine, can you help me with number 2?
Yeah, so number 2, a patient has been prescribed nitrofurantoin macrodantin for frequent urinary tract infection. When the nurse reviews the patient's chart, he is concerned when he discovers that the patient is also taking ibuprofen for arthritis. The patient is also taking Dilantin, Metropol. Is it B?
Yes. Nicely done. Nicely done. Yeah. On the sheet where it says study guide for urinary tract infections, go back and review that. You're not supposed to give nitrofurantoin with Dilantin. Nice job. I'm impressed. Okay, everybody got that one? There are some things that you should know. Look on that piece of paper about the medications for UTIs and what's the other one? Pyelonephritis. Okay, number 3, Sarah.
Betty, why don't you give Dilantin with microdin?
It interferes. It can cause really bad things to happen. Let's see. Let me bring that up. Let's see, I need to bring this down. Oops, let me move this out of the way. Study guide for urinary tract infection. No. Urinary, let me go back, module 1. Session 1, study
Does
guide.
it probably have to do with Dilantin, because Dilantin is for is an anti-seizure medication?
Yeah. So let's look at that. I don't remember off the top of my head.
I think it's in the study guide module 2.
Yeah, no, it's module 1.
Oh.
What it does is it increases toxicity of Dilantin. Here, let's see.
Okay. So would you also not give like lithium stuff that becomes neurotoxicity, or is it just Dilantin?
It just says watch for Dilantin toxicity.
Okay.
Usually they give microdantin for prophylactic therapy, people with recurring UTIs. So
Right.
you want to watch for pulmonary reactions, which are dyspnea, cough, chills, fever, chest pain, peripheral neuropathy. It turns the urine brown, but it says watch for Dilantin toxicity. So what it does is it increases the toxicity of Dilantin. It must potentiate Dilantin.
Okay. In the Davis study guide, or in the Davis drug book, it says increased risk of neurotoxin for drugs that have neurotoxicity. So I guess my question is, why is it just Dilantin and not like other neurotoxic drugs as well?
That I don't know, Amy.
Okay.
This is what I had in nursing school, and I just remember Dilantin toxicity with this type. And this is for people who have recurring UTIs. This is something they take all the time to keep them from having UTIs. So you don't want to mix them with Dilantin. Let's look and see. That's a good question. Thank you for bringing that up. Let's see. It says 145 meds if you look at drugs.com, it says 145 meds are known to interact with nitrofurantoin. And so, yeah. So I guess it's not something that you want to take. Increased metabolize of phenytoin is suggested. So people are getting too much Dilantin when they take Macrobid. Okay? And it says it's pretty much with that. Okay? Amy? All right, let's go back to the test. All right, number 3, Roxy. Would you, well, if there's any kind of thing coming out of the body, you should always do input output, right? So B is definitely true. Is C true? Would you say? Yeah. So the only one that's not true is, yeah, you don't flush stents or other kind of things coming out of the body unless you have an order. You don't do it unless you have an order. This is the one thing you have to have an order. You can't just, flush it. You have to have an order from the doc. And that's part of that. That's also on that study guide for session 1. It talks about stents and other kind of tubing coming out. Okay?
Betty, what is the reason of taking lots of high acid food?
High acid food is to keep the urine more acidic, and that causes, reduces the amount of urinary tract infections. When your urine is more acidic, it reduces infections. The bacteria doesn't like to grow in acidic areas. They often tell you, if you have frequent UTIs to drink cranberry juice or some kind of acidic type juice, and it's to keep your urine more acid. Okay?
Thank you.
All right. Jokey, what about number 4?
Okay, so a patient with hematuria, dysuria, cool clammy skin, and spasmodic flank pain has been admitted to the emergency room. What priority nursing diagnosis would the urine incorporate into the plan of care? Oh, with the nurse. I said the urine, I'm like, oh.
We knew what you were talking about.
I was like, oh, okay. So knowledge deficit related to hematuria, no. Impaired urinary elimination related to ureter obstruction. Yeah, it's B.
Okay.
Need to do the others.
Right. Why is B the priority?
Because the patient has hematuria and dysuria, he's having difficulty passing urine, and then the hematuria with the blood. So it's obstructing the outlet, and so he has impaired. So you have impaired urinary elimination because he can't pee.
Why is anxiety not the priority?
You told us. I don't remember. Well, it's not a priority right now because
What does this person have? What do these signs and symptoms point to?
Of it, I'm thinking BPH.
No,
It's not.
spasmodic flank pain is the key. Hematuria, dysuria, cool cam, and spasmodic flank pain.
Isn't that glomerulonephritis?
Not necessarily.
Or
No,
what's the other one? The pie.
no, not
Oh.
that. Not pyelonephritis. Spasmodic flank pain is related to renal calculi.
Oh,
It's called renal colic.
okay. The renal colic is the one you said it comes and go.
Yeah. And see, that's why B, it says ureter obstruction.
Okay.
Okay.
Uh-huh.
All right. Number 5. Nicole.
Okay. The nurse is caring for a patient who has undergone ESWL, which is the following. Which of the following is the most important post-procedure instruction for the nurse to teach the patient? It's definitely not B. It's not B.
Mhm.
Is it A?
What?
Is it A?
Well, your urine is bright red initially, but it lasts longer than 6 to 12 hours.
Okay.
So it's about 24 hours, I think.
Okay.
24 to 48 maybe. But so what the most important thing is, you got to teach them about infection and how would they might know that they're infected.
C. Is it C?
See, yeah, you want to teach them, if your urine becomes cloudy, you're in trouble.
Okay.
Because with ESWL, you can get infection by breaking up the stone, So, yeah, that's one of the main things that you want to teach your patient. If your urine gets cloudy, I mean, I think that's part and parcel for anything. If you want to teach them, like, if your urine gets cloudy, you need to see a doctor. You probably have some kind of infection.
Okay.
But, now D, why is D not the answer?
I don't know. It just didn't seem like it fit.
Yeah, well, there are some stones that you're not supposed to drink coffee or colas because it can contribute to stone formation. But you don't know what kind of stone this person has.
Mhm.
So there's, I think it's on one of the Panoptos. Go back and review the types of stones and know what the diets are for each one of them. Remember, I said for calcium stones, there's not a specific diet unless your parathyroid is messed up. Most of the time you say there's not a specific diet. Now, if they're eating a lot of ice cream or drinking a lot of milk, you might say, hey, cut down on that, but you're not going to tell them to stop because you need calcium to maintain your bone strength. And there's the uric acid stones. They tell you not to eat organ meats or, those kind of meats. And then there's the other kind, I can't remember the other. There's another kind that you don't want. There's some things you might not be able to drink tea or cola or coffee. So be sure you know the diets that go with each stone. I'm telling you, know that. Okay? Okay? You got it? I'm making hint, hint, hint. All right. All right. Thank you so much. Okay. Elena, can you do number 6?
I don't know, this one's kind of confusing because I feel like it's just a biopsy. It's not would it be B?
Well, they is caring who is going to have a biopsy. What priority nursing action is post procedure? What do you know about kidneys? Tell me a lot of things about kidneys. What do you know about them?
Well, they filter the blood,
Yeah.
and
How much blood do they receive? Unless they, you know, a minute or an hour. Think about how much blood they receive. When you're taking a biopsy, you're putting a needle in the kidney. So what do you think that means? See, kidneys are very vascular, right?
yeah,
So they have a lot of blood going through them. So the main thing you want to look for is what?
just making sure that their blood is being filtered well enough.
Well, a little bit more than that. I mean, you put a needle into a kidney, and then you're aspirating some of the tissue from the kidney, and then after the procedure, you want to make sure that they're not big, complication. This is a complication of a kidney biopsy.
Okay, so if they did like then you have to take frequent vital signs.
Yes. Why?
Because if their blood isn't being filtered properly, then like their heart rate and their blood pressure is going to
Not
be.
just filtering, they could be bleeding.
Oh, yeah.
They could just
Okay.
be bleeding.
Okay.
You're making something, just think about, okay, the kidney's really vascular. They're, risk for bleeding. So what would I do? How would I tell if they're having bleeding issues?
Okay.
Okay?
All right, thank you.
Yeah, does that make sense, everybody? Yeah? Okay.
Yes.
Yeah.
You don't tell them to decrease fluids, not with kidneys. You want to flush them, flush them, flush them. You want to keep a lot of fluids going through them. And yeah, you want to tell the patient to turn, cough, and deep breathe, but that's not the main issue here. The main issue with a kidney biopsy is bleeding. So, and then it's not okay for them to return to their weightlifting tomorrow. They should not lift weights for at least a couple of weeks. You don't want that kidney to start bleeding. Okay? All right. Let's see. Who did I just ask? Was that Elena? Did I lose some people? I got boring?
No.
Okay. So Amy, why don't you do this one?
Then the nurse is reviewing the chart of a 7-year-old male child and notices that the mother states that her son recently started wetting his pants and complaining of pain when urinating. He anticipates that the physician will order A, urinalysis, B, an x-ray of the kidneys, uterus, and bladder, C, a retrograde pyelogram, or D, avoiding cystometry. Yeah. I would say it's A because you're going to start with the least invasive to rule out the most simple thing, which would be a UTI.
Yeah. Nicely done. Good critical thinking there. All right, Sumi, it's your turn again. Can you do number 8?
Okay. The nurse is caring for a patient recently diagnosed with acute glomerulonephritis. His blood pressure is 183/97. She realizes that this is caused by, I think it's C, hypoalbuminemia and the renin-angiotensin-aldosterone cycle.
Good. Yay.
Yay.
Excellent. Wonderful. Okay. All right, let's look at number 9. Number 9, Charmaine.
Number 9, the nurse is reviewing the chart of a patient whose urinalysis shows cast cells, hematuria, proteinuria. She is not surprised when she discovers that his complete metabolic panel shows
What's usually elevated? What do you think this person has?
with hematuria and proteinuria, I would say nephrotic syndrome.
Nephritic.
Oh, okay.
Hematuria does occur in nephrotic. Just
Hematuria. Oh, yeah. It's
So-
hyperalbuminia for the
Right.
nephrotic.
So
Okay.
which one of these you think would be true? Would you have an elevated BUN? Say yes or no.
Yes.
Okay. Would you have a elevated creatinine?
Yes.
Okay. What about potassium? What happens when the kidneys are not functioning well? Would they have a high potassium or a low potassium?
Potassium. For the urine, yes, because everything is going to the urine because. Oh, no, low potassium.
You would have low potassium, low serum potassium, or is that what you're saying?
Yes.
Okay. What about calcium and phosphorus?
Calcium. It's retaining too.
Actually, if phosphorus is high, potassium are high, then calcium is low. Calcium is opposite of phosphorus.
Phosphorus. Oh yeah.
So you wouldn't have serum. What's calcium's? It's 8.5 to 10.5, right?
Yes.
Okay.
Yes.
So potassium is usually what, 3.5 to 5 or 5 to 2, yeah. So it's a
Yeah.
little on the high side. Phosphorus is what? Phosphorus is usually what, 2.5 to 4.5 or phosphate? Isn't that about right?
Yes. I think.
Okay.
I believe so. Yeah.
So this would be D is calcium is within normal limits. No, it's a little low. Let me see what I put on there. I think the answer is actually this one.
You said B.
Yeah, I'm pretty, yeah, B.
B.
But let me look at that. That's on another sheet. Go back and review the study guide on nephrotic and nephritic. I think it has a little more, or maybe the Panoplios have a little more detail on these things, but mainly it's going to be like this. It's going to be B. Okay.
I was thinking the potassium, like the serum potassium would be lower because if the kidneys aren't working that well, they'd be like causing more potassium to leave through the urine. So it would be C.
That's actually usually in kidney disease, potassium's always high.
Okay.
And phosphorus is phosphate and phosphorus and potassium. I remembered P and P is high, calcium is low.
Okay. Thank you.
So, okay. But we can always look at that one. I'll go back to, and we can look at that one a little bit more. Okay, number 10. Who's next? Is it
I think it's me. Is it me?
Jokey?
Yeah.
If you want to do it, go right ahead.
Okay, which of the following is not a characteristic of nephrotic syndrome? So we have massive proteinuria in nephrotic syndrome, and we have hypoalbuminemia, and we have the edema for preorbital edema.
Yep.
The one that is supposed to be hyperlipidemia, not
Yeah.
hyper.
Do you know why?
Yeah, I wrote, you said so I have a question. I put, why do you get hyperlipidemia? You get hyperlipidemia because you are losing protein.
Yeah, it's
The reason?
the lipid portion, your liver is using the lipoproteins
Right,
to create proteins because you're losing them so fast.
yeah.
And so the lipid part is left and it makes hyperlipidemia.
Yeah, so you had said in Panopto that the liver gets the message that you need more proteins, so it starts to make lipoproteins.
Yeah.
Yeah, okay,
Okay.
all right.
Don't you just love pathophysiology?
Yes. Second,
The answer is D.
D. Yes.
D. It's hyperlipidemia. That's what one of the characteristics, hyperlipidemia, not hypolipidemia. Okay. So, Nicole, what about number 11?
Okay. The nursing student is describing the pathophysiology of the most common form of acute glomerulonephritis. Which of the following is correct? I would say D.
What'd you say, D?
It is caused by an
Oh,
infection of the
oh, some of D got messed up. I must have done something with it.
Yeah,
Hang on. Here, let me copy and paste this. Oh no, I have to go find it. When I was doing this yesterday, I must have accidentally deleted it. Oh, good grief. Let me find it. Okay. Let me just find this real quick. And I'll copy and paste it. Yeah, here it is. Now put in India there. We were talking about Indiana pouch. So actually this is the answer.
So C would be more.
Yeah, it's caused by the type 3 hypersensitivity antigen antibody complex. Right?
Yep.
Okay. Thank you. Roxy, can you do number 12? This is just like the question we just had, isn't it? Proteinuria, hyperlipidemia, yes. So it wouldn't be, hematuria is in nephritic, not nephrotic. And you might see hypoalbuminemia, but you would not see hypotension. What would you see in nephrotic? Would you see hypotension? Yeah, hypertension. Okay, all righty. All right. Elena, what about number 13?
You give me the hard ones. I didn't get to like look at this like before you got it to me.
Oh, okay. Well, that's okay if you don't know it. That we just talk about it.
Okay, yeah, I don't really know.
It's on the Panopto for this section.
Okay.
I think it's in the very first Panopto on the first module. And it talks about age-related changes. And it says that you should be careful with certain medications. One of them is gentamicin. One is tetracycline. what's another common medications that old people take for muscle problems or, muscular skeletal problems?
Well, if they've got pain, they'd often take Tylenol, but they'd have to take less because they have smaller kidneys.
Yeah, but Tylenol doesn't affect, it's not processed through the kidneys, it's processed through the
To the liver.
liver. So
Okay.
what's a common medication that is processed through the kidneys? An over-the-counter drug. Well, there's more than one, but
Ibuprofen?
yeah, ibuprofen, NSAIDs. So they have to be very, very careful with NSAIDs.
Okay, well, there's like no NSAIDs as a choice.
Right, but tetracycline is the answer. Gentamicin, tetracycline.
Okay.
There's one other one. I can't remember the other one off the top of my head. But vancomycin is also, sometimes you have to be careful with vancomycin, but it did not make the top 4. So,
Okay.
okay.
All right. Thank you.
All right. So, Sarah, what about 14?
Is it C?
Yes. Polycystic, that's sort of a giveaway. Cyst in the liver, yeah, sort of a giveaway. So what can you tell me about polycystic kidney disease?
I know that it's a condition that produces cysts on the kidneys, and then they also can produce cysts in other places in the abdomen. Like,
yeah, it can be, and it's a genetic disease, right?
mm-hmm.
Okay. All right. All right, let's see. Number 15. Sumi, what about 15?
Did not include.
Yeah. Tell me everything you know about ileal conduits.
I haven't gone over that part. So
Oh, okay. Who can help her? Who can help her? Anybody?
It's the one where the urinary stoma is outside the body. So they're
Yeah. And so what do you how do you collect the urine?
It's in a pouch.
Yeah. So it says, which instructions should the nurse not include in discharge teaching? Would you call it your physician if your stoma becomes pale and gray?
Yes.
Yes. Because any kind of stoma should stay pink or red, right? Should not become pale and gray. That means there's no oxygen getting to it. What about instruct the patient on how to pouch the stoma?
Yes.
Yeah, because this is the type that has a pouch. Would you teach them how to catheterize the stoma?
No.
I don't think so.
No, because the other kind is the one that creates the reservoir, the Indiana pouch, or the other word is Cox pouch or Coke's pouch, however you say that word. But so you don't want to teach them. You're not going to catheterize them. Their urine's going to come into their, like their pouch, like a colostomy bag. So would you teach them to clean their stoma with soap and water?
I think, yeah, gently.
Yeah, gently. Yeah, you want to clean it with soap and water and then rinse and pat dry. So the only one that's not true is you don't catheterize the stoma. Okay?
Yeah.
So go back and have a review on that because you will have a question on this.
Thank you.
Okie dokie.
Okay.
All righty. What about 16? Charmaine?
A patient has had a kidney biopsy that showed renal cell carcinoma. Which of the following is considered the classic manifestations of renal cell carcinoma? Anuria, gross medulla. Would it be D?
Yeah, the main thing that would be gross hematuria, right?
Right,
Palpable abdominal mass, right?
right.
And they probably won't have flank pain because of the fall. That's where the kidney is located.
Right.
You wouldn't have anuria. You wouldn't have oliguria.
Mm-mm.
You wouldn't get, you
Dysuria.
might not have dysuria, but you will have the flank pain, gross hematuria, and the palpable abdominal.
So the key here is it the palpable abdominal?
Yeah,
Right?
palpable
Okay.
abdominal mass.
All right. Thank
Is
you.
this helpful, guys?
Yes.
It is very.
Okay.
Yes, it is.
Okay. Roxy, can you do number 17? Good job. Good job. The other, another priority nursing diagnosis after a radical nephrectomy would be what? Maybe something like, has to do with, bleeding or, one of those nursing diagnoses. It could be a risk for complication bleeding, because they've just taken out a kidney, so they're high risk for bleeding. But in this case, it's an ineffective breathing pattern because of the abdominal incision. That's basic post-operative care, right? Right, right. But that's not really a well-written nursing diagnosis. Usually you don't have a nursing diagnosis within a nursing diagnosis, right? So the main thing in this particular case is ineffective breathing pattern, because you want them to not get, they already have some atelectasis. You want them to be able to take deep breaths. So, okay. All right. Joki, can you do number 18?
Sure. Excuse me. So, which of the following is false about urinary tract tumors? I would say C. Cigarette smoking it's saying it's not, but
Yeah.
it's supposed to be one of the risk
So
factors.
that's not true, is it? Oh,
Yeah.
false.
It's
False. Yeah. Okay, that's true. Yeah, that is the correct answer.
yeah.
Yeah. Painless hematuria. Painless hematuria. What did I say
No.
in class about 4 or 5 times? If you have
It
blood
is.
in your urine, you better go to the doctor, right?
Right.
Okay.
So the place I work, they had this guy that had blood in his urine like a couple weeks ago. After I took the class, after you talked about this, I went back and found he ended up going to the hospital. Turned out that he has kidney stones, and it's so bad that they're gonna have to do surgery on him.
Oh, to get the stone out.
Yeah,
Oh,
it's
wow.
not coming out. Yeah, on its
Oh
own.
no. And so that when you have a stone that doesn't come out, what happens to the kidney?
So the kidney cannot produce.
No, they produce urine.
Oh,
They continue producing urine. That's not the problem. When there's a stone blocking the urine, it backs up into the kidney.
oh, and they cause infection.
It causes hydronephrosis.
Hydronephrosis.
Yeah.
Yeah. So what is that procedure they do to, I can't remember.
The shock, the shock,
The shock, is it shock?
ESWL, it's up here.
ESW. Oh,
Remember that?
Yes, W, yes.
Or
Yeah, shockwave
lithotripsy.
therapy.
It's also lithotripsy. That's the other word for it.
Rido, okay.
Okay,
Yeah.
let's see, where are we? All right. All right. Charmaine, can you do this one, number 19?
All right, so the nurse is asking the mother of a 3-year-old male child with a recent history of hematuria, fatigue, and malaise, weight loss, and fever. The mother points out that the child has a palpable, non-tender abdominal swelling on the left side. The nurse suspects that the child may have which of the following? D, Wilms tumor.
Yep, nice, nice. It's that non-tender abdominal swelling on the left side. Remember what we said about Wilms?
Yeah,
tumor?
it's like we don't know why it's always in the left.
It's 90% of the time it's in the left kidney.
Yeah.
Only 10% of the time is it in both kidneys. Most of the time it's
Both.
in the left kidney.
Left kidneys, okay.
So you might as well, since you're doing so well, just go ahead and do number 20.
Me?
Yeah,
Okay. The nurse knows that if Wilms tumor has metastasized to the lung, the patient will exhibit which of the following manifestation? Shortness of breathing, cough, dyspnea, chest pain, clear sputum dyspnea. Will it be D?
what does it say? It's metastasized to the lung. So it has to be lung issues, right?
Right. So if it's a lung issue, it will be A.
Yeah, shortness of breath, cough, dyspnea.
So that confuses me because he's still having issues on.
Yeah, he still has issues with the kidney, but it says, if the tumor has metastasized to the lung, the patient will exhibit which of the following.
Okay.
So you're saying, you know, they're going to have shortness of breath, cough, dyspnea because now the tumor's in the lung.
Okay.
Okay.
So yeah, thank you. That's the problem when I'm answering test questions. It's different the way I interpret it.
When you have a question,
Mhm.
Jermaine, on Tuesday,
Mhm.
give yourself about 15 minutes and then come and I will be on my on my Zoom and you can ask me questions.
Okay, thank you, Betty.
Okay. I will answer your questions unless you're asking me about terminology, because I expect you to know terminology.
I will remember
No?
that. Thank you.
All right. All right. Sarah, what about 21?
I would say not A.
That's right.
Not C.
Okay.
I want to say it's B.
Did you say D or B?
I said B.
D, yes, that is true. D, you want to take it on an empty stomach, actually.
Yeah.
So go back to the UTI, remember prostatitis, they take the same medications as a UTI. So go back to session 1 on the study guide, and it talks about this medication. And it says wear sunscreen because it does make you more liable to get a sunburn. So what else should you know about any kind of sulfur drug?
The Steven Johnson's.
Yeah. So you would caution your patients about going to the doctor when they have a
Rash.
rash. Yeah. So no, you be sure you know that. Okay. Thank you, Sarah. Roxy, what about 22? So what do you think this guy has? What do you think this guy has? Nope. Nope. He's retaining
BPH.
BPH. Yeah. So what medication here is used for BPH? Flomax, yes. Yes. Tamsulosin. Yep, absolutely true. What is B used for?
ED.
Yeah. What is imipenem? You know?
Is it? Oh, never mind. I can't remember.
I have a slight memory of it having to do something with skin.
Actually, it's an antibiotic. Yeah, it's an antibiotic. Papaverine, I'm not sure what papaverine is, but you should know what tadalafil, or how do you say Cialis, and you should know what tamsulosin. You know, tamsulosin is one of those things that I learned in nursing school, and then I would get patients. I didn't get them all the time with it. Then it was just one of those questions, one of those meds I had to look up every single time before I gave it. I went, oh gosh, I can't remember what it is. And, then I started teaching and I learned what it was. I had to. But yeah, I always had to look it up. Thank you.
Papaverine is also an ED drug.
Okay, it's the ED drug. Is it one of those that they inject?
No, they can. It's also PO. So
Okay. Okay.
they have an extended release one too.
Oh, okay. I'm not going to ask you about that one. The ones I will ask you are like, Viagra, Cialis, and I'm going to ask you about tamsulosin, Okay. What do you know about Viagra or Cialis, one of those types of meds, those ED meds? What do you know you should not, what would you be concerned about if your patient was taking what? They got a prescription for Cialis or Viagra, and then you notice on their chart that they're also taking
blood pressure meds.
Not just any kind of blood pressure med, but also really dangerous is nitroglycerin.
Oh yeah.
So you don't want them to be on nitroglycerin, but really you don't want them to be on most, you got to caution them when they're taking a blood pressure med. Okay. Nicole, can you do this one?
A 70-year-old male patient has just returned from the PACU after undergoing a transurethral resection of the prostate with a 3-way continuous bladder irrigation catheter. What is the priority nursing diagnosis for this patient at this time? I'm in between B or D.
Well, which one has to do with the bladder?
The B.
Yeah. Yeah, that's priority, because what happens when you have continuous bladder irrigation? What's the complication that can happen with it?
Fluid volume overload.
Yeah, fluid volume overload. So that's one of the things, and then your electrolytes get really out of whack, right? Sodium can go low, and then you have confusion and all this other stuff. So you got to be careful about that. That's called the transurethral syndrome, transurethral syndrome. So, I talked about it some on Tuesday. And you're having a case study on it, right? This week. Did you guys like the case studies that we came up with?
Yeah.
Yes. Mhm.
Yes.
We came up with those by ourselves,
Yeah, that was good.
Actually, Eric did one, Amy did one, Laura made one, Chris made, she made actually two, can't remember. And I did one. And then for simulation, I'm doing a mass casualty incident simulation.
Except there was one with weird labs that he gave us a hard time. I don't remember which. There's one
That was the neuro one.
It was the one that
Where like the labs were all messed up and Bun was 150 and
Yeah,
yeah.
he made up. I don't know where his head was. Did you make fun of who has Eric? Any of you?
No, me.
No. Yeah, we gave him a hard time about it. Eric, where was your head? So, okay.
I had Eric, Betty, and yes, we gave him a hard time, especially on that bun, because we're like, this guy's dying.
What did he say?
He said he just had a brain fart.
Did he realize that he had made a real big error?
He did, especially when he was reading them. I think there was a medication that was wrong too, or maybe it was the like the rate of the fluid IV infusion, and so he was reading that and he's like, nope, that's not right either.
Well, he usually doesn't make those kind of mistakes, so I think that's pretty hilarious. Okay, you gotta laugh at this stuff, let me tell you. Okay, Elena, can you do number 24?
Yeah, I was thinking it would be A.
Yeah. Yep. A, multiple sexual partners is a major risk factor. Nice job. All right, Nicole, what about 25?
Okay. A 22-year-old female patient's colonoscopy, or does that say
Colposcopy.
and pap smear reports show precursors of cervical cancer. The nurse anticipates that the patient may need to undergo which of the following conservative treatments? Conservative treatments.
Which one's conservative?
It would be B.
Yeah. What is cryotherapy?
Is that like where they freeze off?
Yes, Nicole, perfect. Yeah, that's the most conservative. What's D and C used for? Anybody know?
It's like they're taking out everything, right? Like certain parts of the uterus.
Well, no, dilation and curettage is usually used after some kind of miscarriage.
They use, oh, yeah, I was gonna say when someone has miscarriage, they do DNC.
yeah, just in case they want to get all the products of the miscarriage out of the uterus, because then it can cause infection. So they usually have somebody have them come in and do a D&C. So they dilate the cervix and then they go in with a scraper and scrape the uterus.
Betty, I was also reading recently on DNCs that they are using them they sometimes use them for diagnostic
Yeah.
components as well, especially in people who have signs for uterine cancer.
Okay. Thanks for bringing that up. That's good knowledge. Thank you. Okay. Let's see. I guess I'm back at Sumi. I just rotate. Oh no, Amy, can you do this one?
I was wondering.
I have, you're at the top. Go ahead, Amy, go for it.
I think it's A.
Yeah.
Yeah.
No, actually
Oh, wait,
not.
major risk factor for testicular cancer is, oh, that's where, this is the one where the testes don't drop. So
Yeah.
is that the cryptochidism?
Chidism, yes, cryptochidism. Yes. What's B? Tell me what B is.
I don't know.
That's where you have an extended erection for more than 4 hours.
Okay.
In fact, we're going to talk about that in 27. So, Sumi, what about 27?
Of the penis. The student nurse is aware that his condition is classified as a urologic emergency because of the potential for D?
Yeah, permanent damage to the penis. Yeah. Okay. All right. Charmaine, can you do number 28?
All right. So a patient with, how do you pronounce this?
Leiomyomas.
Okay, a patient with leiomyomas has been prescribed leuprolide or Lupron to help with her symptoms. What important information should the nurse educate the patient about this medication? So medication is cause, not flashes and budget. It's not causing. If you become pregnant, spending will not harm your baby. I would go, will it be A?
Yeah.
Okay. Yeah, because that's
Leuprolide is a hormone and sort of puts you into menopause. It's to reduce the amount of hormones that make the myomas grow. So yeah. And it is, I think it's tetragenic. So you don't want to get pregnant while you're on it. All right. Sarah, what about 29?
I'm going to say D.
What'd you say, D? Prostatitis? We just talked about this. So what does erectile dysfunction meds, what were they given for first?
Oh, for blood pressure.
Yeah, so
hypotension.
Right. So if they have a history of hypotension, you're going to be concerned about that. Because if they take that, it's going to push all their blood to their penis and they're going to pass out. It's weird how that happens, huh? Okay. Roxanne, can you do number 30? No, no, usually, well, it could have high, no, that's not, no. There were two components. If you go back and review what I said in the lecture on Tuesday, there's a slide that talks about erectile dysfunction, and you always want to rule out the organic, any organic reason. And then after that, you want to look at the psychogenic. So it's psychogenic and organic components. Yeah, it's B. All right. Jokey, can you do number 31?
Sure. So which of the following male is most at risk for prostate cancer? I'll go with the older 75-year-old African American whose diet is rich in red meat and dairy products.
Yeah.
Because I know the risk factor is older age.
Older age and also African American.
Yeah.
So, okay, good.
Hey, Betty,
Yeah,
I can't remember. I remember reading in the book there was something that Japanese Americans were also at risk for, or a higher risk for,
Japanese Americans
or Japanese, yeah.
or Asian Americans, they're at high risk for gastric cancer.
Okay.
I had a lot of Asians for patients who had gastric cancer. And it's awful. Gastric cancers, ugh. Gosh, I wouldn't put that on anybody. It's awful. It's hard to treat. They end up with no stomach. It's just really terrible. So it's mostly, I don't really, you would think they, but I think it has to do with raw fish in some ways. I'm not really sure about that, but I know that Asians are really at high risk for gastric. But I may be wrong, but I'm pretty sure. Okay. Let's see, who was that answered that?
To me, is saying spicy foods.
Spicy, yeah, maybe so. Nicole, can you do number 32?
The nurse is providing an educational event at the local PTO on prostate cancer. A 53-year-old male attending asked about the prevention and detection of prostate cancer. What information should the nurse provide to this attending that would assist in early identification of prostate cancer? I would say A.
Yeah. Digital rectal exam done yearly after age 50. That is it. Okay? Nice job. Testicular self-examinations for testicular cancer, especially after, starting with a boy, 14 or 15. You want to teach them how to do that. My grandson, who is 12, has known how to do that because his mother is a physician. He has known how to, you will ask him, do you know about testicular cancer? Yes, Nana. Yes, I know. I'm supposed to check my testicles. He's so funny. You can tell he has a grandma that's a nurse and a mother who's a doctor. All right. Let's see, who was that? That was Nicole, wasn't it? Elena.
Okay, I was thinking A.
Okay. Is asking what priority nursing diagnosis?
Well, I mean, actually, I was kind of like torn between A and B because like it seems like he's anxious about sexual dysfunction. Like we don't know if he has sexual dysfunction yet.
Well, usually if you go back and look at radical prostatectomy, a lot of times they do have sexual dysfunction. when you totally remove the prostate, you can have sexual dysfunction.
Yeah. Well, I guess it's to be expected.
Yeah.
Okay.
So especially if they, remember I said if they take the nerves that are innervating the penis, I mean, you know, the prostate and the penis,
Yeah.
they may have trouble having erection. So, you know, in that regard, then they would have erectile dysfunction, and then they would probably have some kind of a insert if they wanted to continue doing that. There are ways around it, right? So, okay, 34. Amy.
Yes, sorry.
That's okay.
A patient had right modified radical mastectomy 3 years ago and is admitted for a cardiac workup for chest pain. What intervention would be a priority for nurse to implement? Okay, so you would probably want to ask about the lymphedema, but then you'd also post the sign on the wall not to use the right arm because it was the right, yes, right?
Yeah, so you want to post a sign. Mm-hmm.
Right, because that's implementation and the ask is an assessment. Yeah.
Very
okay.
good. Very
So,
good.
Betty, would you still post that sign even though it was 3 years ago that she had her mastectomy?
Yeah, I would say a lot of times doctors usually say after 5 or 10 years you don't have to, but I would post one and then I would find out. I would not want any kind of venipunctures or blood pressure on that affected side until I found out. So, you know, this person's being admitted, so you might not know. It's always best to be safe than sorry. In my opinion, you want to post the sign. This is like standard of care of people with mastectomies. So, but you know, if it's been 10 years, you can ask the patient, you know, now this is not what my question is, but you can ask the patient, you know, have you had lymphedema? You know, what is your doctor's, you know, your doctor's thought on that? You could do that, but this is only 3 years ago, so you want to be careful.
Hey, Betty,
Okay.
I have a question.
Yeah.
What if you were to have a double mastectomy?
Okay, this question was asked yesterday. Jokey, can you tell her what I said?
I remember you saying, like, for taking blood pressure, you would do it on the leg.
Yeah, you would do them on the leg.
On the leg, yeah.
So you would say no, you know, no blood pressures or venipunctures. You may be able to get away with it, but you would have to be very careful with it. But no blood pressures on either arm. Not 3 years. I would, you know, maybe after 5 to 10, but not 3. It's always better to be safe than sorry. And I have taken blood pressures on the leg more than once, let me tell you. It's not easy. It's much easier with an automatic blood pressure cuff, but I have taken manual blood pressures on the leg. You use the popliteal artery, or you can actually use, sometimes you can use the post-tibial, but you know, it's difficult. Okay, we wouldn't use the post-tibial. No, I used the popliteal, the one behind the leg. Okay, what about, let's see, whose turn is it? Is it Amy? No. Who was the last person who answered?
I answered the last one.
Oh, thank you, Amy. So 35, I guess it's back down to Sumi. What are the risk factors for breast cancer?
Obesity,
Yep.
nulliparity,
What does that mean? Do you know?
not having baby.
Right.
Also menarche. I don't remember
Yeah,
this.
early menarche.
Menarche.
That means what?
I don't remember. What was that?
Early menses.
Oh, okay. Early menses. Yeah, that probably, yes. I think BCD.
Yeah, BCD. You are correct. Thank you, Sumi. What about Sarah? What about number 36?
I'm going to say A.
It could be, but what do you know about endometrial cancer, also known as what kind of cancer?
Uterine.
Uterine. What can happen? What is the primary sign and symptom of uterine cancer?
Bleeding.
Yeah, so usually it's a risk for complication anemia.
So C.
Yeah. If the tumor is large, you could have impaired gas exchange, but the main thing you need to remember about uterine cancer is it's bleeding in a postmenopausal woman, so they can become anemic, especially if it's heavy.
So
And women will just ignore it. And you go, what?
So I have a question. So if you have an exam question that's like this, that's you trying to decide what's the important between the nursing diagnosis and the potential complication,
Right.
would it usually always be the potential complication? Like, do those trump the nursing diagnoses, or is it more case by case?
I think it's case by case.
Okay.
But I'm not going to ask you one exactly like this. Like I said, I changed how I ask these questions. So
Okay.
this is one of the first exams I ever made. So I have changed things, believe me. But I thought this was good because it has a lot of signs and symptoms in it. And you have to know them so you can answer the questions. Okay? All righty. Charmaine, can you do number 37?
Okay, a nurse is caring for a patient who has just been diagnosed with breast cancer and is positive for BRCA1 and BRCA2 genes. When planning patient education for this patient, the nurse recognizes that the patient has an increased risk for developing ovarian cancer.
Yes. Yes. Well done.
Thank you.
Our last question for the day. Sarah, can you help me do this one?
I would say probably the urinalysis and culture and sensitivity, because you want to start with the least restrict or invasive.
Okay, this is a 70-year-old postmenopausal. Vague complaints of back and abdominal pain. What do you know about ovarian cancer? The reason I know this is because I like to put my questions together, although now your test doesn't put things together. But actually, you want to do a transvaginal abdominal pelvic ultrasound with the CA-125 because these are the signs and symptoms. Remember, vague GI issues, back and abdominal pain, bloating, indigestion, vague GI. You want to always rule out ovarian cancers. Okay. I mean, you could do with urinalysis and culture, but she's not saying that she's having problem peeing. Does that make sense? Right? Am I wrong?
I still feel like they would do the urinalysis with the abdominal pain just to like Sarah said, like
Okay.
least invasive, rule out anything,
Okay,
especially because sometimes the UTI symptoms for older adults look different.
that's true. That's true. I will make sure that the question I asked you about ovarian cancer is more specific than this one. Okay?
Okay.
Because there will be a question of ovarian cancer, mainly because it's a very insidious disease and it has a poor prognosis. And so I think, it's good to have a question on that so so I'm sure that you will study it, okay? So there will be a question on pretty much every type of cancer that we know. Okey-doke?
Okay.
You guys have any other
Thank
questions you
you.
want to ask me? You asked really good questions, so I don't have anything else for you guys. If you want to ask me any other things, that's fine. But this is all I have planned.
Thank you, Betty. This was very helpful.
Good.
I think
Thank you,
doing
Betty.
it 2 days, it was helpful for me.
Good, Jokey. I'm glad it was helpful for you.
Yes, thank you.
So maybe this showed some of the things that you need to go back and review. So hopefully it was helpful. I can't think, I think we covered pretty much a little bit of everything. So yeah, okay.
Thank you.
You're welcome.
Thank you, Betty.
Okay. Any other things you want to bring up? All right. Well, then I'll see you guys on Tuesday. Okay?
Okay, thank you.
Okay. Bye.
Okay.
Bye.